Welcome to this week's edition of Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece. I'm Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, media medical expert. I help you feel and perform your best regardless of age, injuries, or medical histories. Very excited to have you here. Cheyenne, hey, if I'm saying that, I apologize. Jamie, I hope you're having a great Friday as well as you, Tammy. And if you are here, I would love it if you would leave, because you're only doing this in YouTube. I don't do this show on Facebook or LinkedIn, unlike Better Than Ever Live. But if you're on YouTube, please know that if you want to ask a question, because that's what we're here for, it's Ask Dr. Geier Live, put it in the chat, not in the comments. I can only see the chat, so I will definitely try to answer any and all questions you have. As always, this is not meant for medical advice. This is general information and educational purposes only. I haven't seen you, I haven't examined you, I haven't looked at x-rays, MRIs, or anything like that. So I am just commenting in a general sense. But you can take that information and go to an orthopedic surgeon wherever you are, using that information to try to make the best information or make the best decision for you. You're also welcome to come see me here in the office in Charleston, South Carolina. I would love that. It is a beautiful day. It's like, what is it right now? I think it's like 72 degrees. Where are we? Come on, 76 degrees and perfectly sunny. So very, very good. Also, before we start, we'll talk questions if you want to submit those. And please tell me your first name and where you are if you want to ask a question. I would love to know where you are. But I am celebrating my Memphis Grizzlies pulled out one of the most improbable wins in the NBA playoff history last night, coming back from 26 down late in the third quarter, but they were down by 25 in the second half, clawed their way back from that lead, then got down 26 and managed to pull it out. I haven't talked about it much on this show or Better Than Ever Live, but on my That's Gotta Hurt Live show that I used to do, I have told people I am from Memphis, Tennessee. I am now in Charleston, South Carolina, but I am a lifelong Memphian and Memphis Grizzlies fan. Very, very, very excited for them last night. All right, so yeah, feel free to ask your questions. I stay as long as there are questions, and then I end the show at that point. So definitely do that. And also, if you're watching this in replay, know that I don't answer these ahead of time. So pre-loading questions, things like that. It's meant for a live show. So I interact with people that are here live, sending them to me ahead of time somehow. I don't turn around. I just have no way of collecting those and bringing them to the show. So this is just for people that are here live. So Tammy, that's really interesting. She had COVID in December, no sense of smell. Is there anything I can do? I am not aware of any treatments as of now that necessarily make it go away. I know that a couple things. One, there is thought that over time it does restore. I have heard suggestions that maybe an oral steroid, dexamethasone type of thing, might help it go away a little bit faster, but I am not aware of any. Fortunately, and I don't do a lot of COVID treatment. One of the other doctors in my practice does some of that. That does tend to be something that resolves, but there is still a lot we need to know about it. So I wish I had a more definitive answer for you on that one. It really sucks though. Keep coming each week. Let me know how that goes and if it responds, and I'll try to ask around and look into that a little bit more. That's one that I should know a little bit more about as far as loss of smell, because I talk about it. I talk about COVID on my 2 TV stations that I do segments for every day. I do know that loss of smell is becoming less and less common with the new variants. The Omicron and the BA2 version of Omicron don't typically have loss of smell like the Alpha version, Beta, and Delta typically did. All right, let's see. And no, Jamie, I didn't get it. So definitely send that one my way. Georgia. ACL surgery Tuesday, general anesthesia, not a spinal block. Georgia from Greece. Very excited you're Greece. Okay, I can't speak for how anesthesia is done in Greece typically. There's certainly regional variations even within the United States about how surgeries are performed, what grafts are done, things like that. This is what I'd say. Spinal anesthesia, at least in the United States, is not done much at all. Meaning they do a block basically that makes you numb from your waist down, because typically, here's why, they don't a spine, it's called spinal anesthesia, tends to mean you have to stay in the hospital overnight. And ACL surgery is an outpatient surgery here in the United States, whether you do it in a hospital or you do it at a surgery center. So a spinal would basically keep you there too long because you can't go home if both legs are numb. You can't walk. You have no control of your bowel or bladder typically, so you'd have to have a catheter, things like that. So it's just not done. The options in the United States, and it can be a combination of this, but typically what's done is you do a regional nerve block, meaning you block the nerves that sort of give sensation to the front of the knee and to the back of the knee, or just one. Typically, if you're going to do just one, it's a femoral nerve block, but a lot of times it's femoral and sciatic, whether it's a one-time injection of a numbing medicine or it's an ongoing an indwelling catheter that gives you pain relief for 36 hours, 48 hours, something like that. But that usually, even then, is not alone. I have done ACL surgeries where it was just a nerve block and then a little bit of sedation, and those are typically high school kids where that was done. But usually it's a short-acting general anesthesia. They'd put you to sleep for an hour or something like that with a nerve block is typically how it's done. You don't have to have a nerve block. It can just be general anesthesia, and then you just inject a little bit of numbing medicine into the skin. But ACL surgery is usually painful painful enough that at least surgeons here like a little bit more than that. And so at least in the United States, that is a regional nerve block, something that just makes that leg numb for an hour, hour and a half, 2 hours, sometimes up to about 6 hours, but typically the shorter the better. But that I can't speak for Greece. That would be my thoughts on that. And again, I don't know how Greece is, but this is sort of a message generally for people that are watching this. You're the patient. You ultimately decide what happens and have input on what happens. So talk to the doctor, the surgeon, talk to the anesthesiologist before surgery about how it's going to go, what the options are, and then make the decision that is best for you. At least in the United States, you have input on all of that. Jake recently had meniscus surgery. Meniscus was repaired. I think that's what that says. Well, in the knees and the brace. How easy would it be to undo the surgery if you have a slight twinge when twisting? All right, I may have misread that. So it sounds like he had a meniscus repair where, if you can see the inside of the knee here, you got the medial meniscus, you got the lateral meniscus, and a meniscus repair means that they sew it together with stitches as opposed to trimming part of it out. That's far less common than the surgery to trim part of it out, mostly because most meniscus tears are not torn in a way that you actually can sew it back together. But one of the things that a lot of surgeons do with a meniscus repair is they put your knee in a brace that limits how far you can bend it. Basically, so you can't bend it all the way back. That's as far as my knee model will go. But so you can't bend it to 120, 130 degrees. So a lot of times, and I used to do this too, would put them in a brace that basically only let the knee bend to 90 degrees. And that was to protect that repair so that you didn't basically tear out the stitches. And if the brace is doing its job, it should only allow a certain degree of range of motion and allow no twisting or side-to-side motion. So typically wearing a brace just doing normal things, you're not terribly likely to do harm to it. Without knowing more, that's generally what I would say. Those stitches are certainly fragile and the repair is fragile, but not typically enough that you couldn't, I don't know, it depends on if you're allowed to put weight on it. Especially if you're not allowed to put weight on it, I would think it would be hard to do damage to a repair in a brace. So my thought. You are very welcome, Tammy. As far as how long to return to sports after a meniscus repair, again, and I say this a lot on this show, the amount of time is not actually all that important. When we tell people some recovery is 6 weeks or 6 months or 3 months or whatever it is, those are just averages based on what we typically see. What you would want to see with a meniscus repair, obviously, we want the repair to heal and to be solid, and there's not really great ways to do that. You can get an MRI or an MR arthrogram, but even that can be a little misleading. But it's getting the repair to heal, but then it's getting all the motion back, all the strength back, being able to do sport-specific activities. And I will tell you that length of time is getting longer and longer. Again, those averages. If you look at NBA players, and I told you, get a chance to plug this again. Big Memphis Grizzlies fan. Jaren Jackson Jr., one of our star players, had a meniscus repair in 2 seasons ago in the bubble season for COVID, and it was about a year before he came back. You look at James Wiseman with the Golden State Warriors and a number of NBA players, the time is now getting to 9 to 12 months on a meniscus repair. Again, no, those are elite athletes, but typically I would still say probably minimum of 6 months, but even longer. You want to do everything you can to get that meniscus repair to heal. The problem with a meniscus repair is that the types of meniscus tears that can be repaired, the tear is typically toward the periphery, the outer edge, that's where the blood supply is. So if that fails, then you have to go in with a second surgery and trim that out. You're losing pretty much the entire meniscus, and then you develop arthritis in a hurry. So that's why the times, especially in these pro athletes, are so long. Let's see here. Cesar from Brazil, very exciting to have you. I don't know that I've had a Brazil person in a long time. That makes me really, really happy. All right, Jamie, nerve block instead of cortisone shots. Hang on, 5 yesterday, a lot worse than today. I'm not 100% sure I necessarily understand. One thing, and I apologize if this isn't what you're asking, feel free to follow that up. Cortisone shots, one of the reasons I hear people say sometimes they had a cortisone shot with somebody and they actually got worse, like, 6 hours later, 8 hours later, the next day they were a lot worse, is that it's a lot of doctors and especially general practitioners, family medicine doctors, but even orthopedic surgeons, it's not just cortisone. It's not just steroid that's being injected, say, into a knee or a shoulder. It's a combination of the steroid plus a numbing medicine, sometimes lidocaine, sometimes marcaine, sometimes both. And those are temporary painkillers. So a lot of people are like, wow, I feel great right after they have them. Their knee, let's just say knee arthritis, feels really good. But that cortisone takes a couple days to kick in, 2 or 3 days to kick in. The numbing medicine takes effect right away, but it wears off fairly quickly. So when you hear somebody say that they felt great for an hour, they felt great for 3 or 4 hours, and then it hurt worse, it's because, yes, they got pain relief from the numbing medicine, but then the cortisone hasn't kicked in yet, but now they've got a big swollen knee or a big swollen shoulder, which hurt. So that's a pretty common thing. Not sure exactly, Jamie, in your case, if that's what you're talking about, but we see that a fair amount. Yes, you'll just have to ask about the regional block. It would be interesting if they didn't do that, but it may be a skill that maybe anesthesiologists in a different place don't have, but definitely ask. Usually, I will say with the whole thing about people not wanting to hear or see, so there are a lot of surgeries that are done with spinal anesthesia, meaning you're numbed from the waist down, where in theory you can hear it, but they usually still give you a sedation so you don't really remember it. So I think people worry about that more than it actually would happen. You may vaguely remember some sensations and sounds after the fact. You think, oh, maybe, but it's not like you're just wide awake. I suppose you could be, but that's just typically not what I have seen or been experienced to. Jake is a UK big soccer fan player. Who is your team? I'm not going to go grab it from here. Well, you can see it. I am a Liverpool fan, which Liverpool, probably one of the 2 best teams in Europe right now. I've been a Liverpool fan for over 20 years now, so I am not a bandwagon fan. I have been diehard Liverpool, love everything about them. So I am excited to hear your fans. All right, I'll stay on just a couple more minutes and wait for any more questions. One quick thing. So I always talk about how this is not medical advice. Very, very serious about that. But if you would like to come see me, you want to talk about treatments other than surgery or cortisone shots or physical therapy, which seem to be pretty much all that is offered to people when they go see orthopedic surgeons in this country now, and that's a whole other discussion as to why that is. But I'm happy to see you. I see patients from all over the place here in Charleston. I have a Charlotte office, but if you're flying in from outside of North or South Carolina, we have you come to the Charleston office. I am happy to help. There's a link to my website in the description below this video. Go to that takes you to drdavidgeier.com, and that will if you go to the Work With Me page, there's a drop-down tab, go to Contact. There's a form you can fill out, and we can talk about how you can see me in the office. Also, make sure to subscribe. There are all my social media handles. Leeds United. Now, that's really interesting. I don't follow Leeds. I think Jesse Marsh is great. Fantastic, actually. Very, very good move on your part. I am waiting to... I have yet to get to Liverpool since I became a Liverpool fan. I've been to London twice, which would not be a long train ride to Liverpool, but that was really when I was young, not in the time of being a Liverpool fan. And yeah, I've been through Michigan traveling, but I have not spent any time there. I have friends that go to Mackinac Island, and they love it, but I have not had the chance to do it. All right, and then Georgia asks the last questions we'll talk about. How long will it take to walk normally and drive after surgery? So that's really 2 different things, and I'm going to answer this. There's 2 different, the answers are not the same. One, depends on, are you allowed to put weight on it after surgery? And that gets to, if you have an ACL reconstruction, you're typically allowed to put weight on it. But if they also have to do a meniscus repair where they sew the meniscus back together, very often the surgeon will not let you put weight on it for the first maybe 4 weeks or something like that. So it depends a little bit on what they find when they get in there. As far as driving, depends on which knee it is. If it's an automatic car where you don't have to push the clutch, and it's your left knee having surgery, then some people can drive pretty quickly after surgery. If it is your right knee that you use to push the gas and to push the brakes, it's probably going to be more like 2 to 4 weeks. Again, averages depends on some specifics about the surgery, but that tends to be how to go. Tammy is from New Hampshire near Lake Winnie. I don't know that lake, but New Hampshire, from what I hear, is beautiful. That's a state I have actually never been to, but I hear it is amazing. Jake really is happy with Jesse Marsh. If you ever want a ticket for a Liverpool game, I might take you up on that. Big Liverpool fan. I missed the thrashing of Manchester United Tuesday, which really, I wish I could have watched it because I absolutely cannot stand Manchester United. I don't like their fans. I don't like anything about that team, and I know people are going to watch this on replay that are Manchester United fans. It's nothing about you personally, but every person that I know personally that's a Manchester United fan. I know there are people in England that are lifelong Manchester United fans, but every American that I know that's a Manchester United fan is a fair weather fan. It's like a Lakers fan. It's like a New York Yankees fan. They only became interested once they became winners, and now they've become really quiet, actually, which I think is really interesting. So, for what it's worth. But Jake, I will definitely take you up on that. Georgia, you're very welcome. All right, that is all I've got for you. I have got to get back to work. I was out earlier this week. That's why I hopefully look a little tanner than I normally do. Was out on vacation, but I've got to get some stuff done today. Very excited to be here. I will be here all next week, Tuesday, Thursday, 5 p.m. Eastern for Better Than Ever Live. Don't even know what we're going to be talking about yet, but it should be fun. And I will be here again next Friday for Ask Dr. Geier Live. Jamie, you are very welcome. And yes, you be safe as well. Thank you for joining me. I will see you right back here next week. Have a fantastic weekend. Take care.